Welcome to this Bolder Healthier Community Champions webinar on mental health. I'm Dr. Justin Varney. I'm the Director of Public Health, Birmingham City Council, and I'll be taking you through the webinar today. So it might strike you odd to think, why are we talking about mental health in December, and why at this time of year, which is normally such a happy and celebratory time of year, should we be thinking about mental health? Well, the reality is that many people do experience worse mental health in the winter. Some of this might be down to seasonal affective disorder, SAD, which affects about 2 million people in the UK. Some of it's because at this time of year, although many of us do have family and friends to spend it with, some people don't. It's also a period in which we reflect, and if we've had a bereavement, for example, or we've had a major health issue, that can all affect our mental health, as well as perhaps the loneliness of being alone during a festive season when people are celebrating together. This year particularly, of course, there's the added financial pressures that people are under, which are causing real stress in people's lives. So all of those are good reasons to talk about and think about mental health at the moment. But we thought we'd start with a short video just to kind of get us all in the same page about what is mental health.
We're here to make sure everybody with a mental health problem has somewhere to turn for advice and support. In the past, people thought if you had a mental health problem, you would never feel better. You might meet people who still feel this. Maybe you feel this way about yourself. Mental health is just like physical health. Everybody has it and needs to look after it. You have good mental health if you're able to think, feel, and react in the ways that you need and want. You might need support with your mental health if you are finding the way you're thinking, feeling, or reacting is more difficult or even impossible to cope with. This might be because of things that are happening in your life right now. A traumatic event may affect your mental health in a big way too, even years later. We are all different. Everybody experiences a huge variety of feelings, thoughts and emotions as part of their normal life. But how and when we have them can be really different depending on who we are. Some of us can find these harder to cope with. This can be because of our upbringing and childhood, past experiences, or the things happening in our lives right now. That's why it's important that only you, someone who knows you really well, or someone who is qualified, gets to say when you need help. If your feelings, thoughts and reactions are getting in the way of how you want to live, if you feel things aren't right, if you feel like you need help, you can ask for it. We're not going to pretend it's easy. Mental health problems can change your life, and for some they can be overwhelming. But that's why Mind is here. We're going to face it with you. We'll listen, give support, and fight your corner. To find out more, visit mind.org.uk. We're Mind.
So I thought that was a good way to start the webinar, talking a little bit about what is mental health and how it affects all of us. And when we talk about mental health, we know it's important for everyone. It's just like our physical health. You can't have good physical health without good mental health, and similarly, good mental health needs good physical health. And it affects how we do everything every day, and our mental health can go up and down, like our physical health. We know that around 1 in 4 adults will get affected by a mental health problem every year, and these range from issues like anxiety and depression, which can be relatively short-term conditions, to those such as schizophrenia and bipolar disorder that can be long-term mental health conditions. And we've included in the slides some data for you. I'm not going to dwell too much on things that you can read after the webinar in more detail, but mental health issues are very common, and it is really important we talk about them more, because, as I've said before, if we don't talk about mental health, then people don't feel able to reach out for help. But also, we're missing a trick in terms of supporting people, and in the same way we should talk about diabetes or smoking and physical activity, we should be talking about how to help people remain mentally healthy, and when they do have a mental health issue, how they reach out for help. Now, your mental health is a kind of combination of your genetics. So there are some mental health conditions like schizophrenia where we know there's a genetic component, but it's majority driven by the environment we live in, the jobs we have, our relationships with people, the things that happen to us. that can impact our mental health, and in the same way that the world around us has a big impact on our physical health. So some of the things that can impact on our mental health: big life events, bereavement, having a new health condition or a health diagnosis like a heart attack or a stroke, for example, but also how connected we are to our social networks, to our family, to our friends, to the community we live in. And we know that loneliness has a particularly negative impact on people's mental health. And more we're starting to understand the role of social media. And much as it's great to be able to use the internet to record this webinar and share it with many of you who wouldn't necessarily be able to come if we were holding this as a face-to-face session, we know there are some really good examples of negative impacts of social media, and that way that social media platforms work using algorithms can create this incredibly negative environment which just fills people's social media feeds with negative information. We also understand now much more the power of online harassment, bullying, and stalking. All of those things can have a really negative impact on people's mental health. So it's important to acknowledge that and recognize that as one of the things that impacts on our mental health and our well-being. As I said, there's a big overlap between physical health and mental health, and we've included this slide in the pack just to give you a bit of a sense of that proportion. But for many years we've been saying you can't have good physical health without good mental health, and vice versa. But when we think about the health service and the way that we talk about health, we do get very fixated on the physical health, and we perhaps give less attention than we should to supporting people's mental health and helping them when they have mental health issues. This is a video from Barking and Dagenham, from the young people's group in Barking and Dagenham, and I thought it was a really good one, partially because in the video they share a lot of different mental health conditions, and you'll see that on the tape across people's mouths, but also they're doing some really good myth busting. So let's watch this for a minute or two. A great video there from the young people in Barking and Dagenham in East London, and talking really powerfully about why it's important to break the stigma around this. Now, I'm just going to talk for a second about anxiety and depression, because these are two of the most common forms of mental health issues that people have. And there is a bit of overlap between the two of them, but we thought it was useful to just share a little bit about some of the symptoms and how they connect to each other. So in both anxiety and depression, people experience excessive worrying, difficulty having concentration, restlessness, sleep disturbances, and withdrawing from society. But where the difference comes is that people with anxiety often have panic attacks, those palpitations, sense of sweating, that sense of impending danger. Whereas in depression, people tend to have more feelings of hopelessness, of fatigue, of irritability, of grief. And so this just kind of sets out how they kind of overlap with each other, because people can have anxiety and depression. It's not necessarily you have one or the other. You can have both mental health issues at the same time. But because they were quite common, we thought we'd include them in the pack and just to help people get a sense of it. Although these are also things that happen to people that aren't clinical mental health issues, so all of us will get anxious at some point in our life. Where it becomes a mental health issue is when that anxiety or that depression is lasting for weeks or months and is becoming really embedded as a way of being, and that's where it becomes a health problem rather than a natural response to something that naturally is making you feel sad, or something like exams or a deadline where it's absolutely normal to feel a bit anxious. I've included this little short video just about anxiety because I think it is something that many of us experience, but it helps explain a little bit about the difference between kind of everyday normal reaction to stress and when anxiety starts to become a mental health issue.
Mixture of things. We're all different, and there are many different feelings we can experience at different times. Some are more well known than others, such as excitement or anger, but some can be harder to understand, like anxiety. Millions of years ago, we relied on anxiety to keep us out of harm's way. At the slightest sign of danger, our bodies would bring on this uneasy, urgent feeling to jolt us into action or get us to run away. These days, our bodies still try to protect us, but life's evolved. There are loads more things to worry about, and they have a habit of piling up without us noticing. Anxiety can feel like all kinds of things. That twisted, shaky feeling in your stomach, or the strange nervousness that makes you want to hide away from the world. It can make you tired, frustrated, and upset. Anxiety can start as a simple worry, but grow into a panic and convince you that you're losing it altogether. It can make you scared, restless, speed up your heart, but give you no explanations as to why it's happening. It might not feel like it, but anxiety is completely natural and can affect anybody for all kinds of reasons, like exam stress, family troubles, new places, or a mixture of things. It can even come for no apparent reason, but the good news is that you can reduce it, and the first step is to talk about it. Talking about how you feel is a great way to feel better. You don't have to face things alone. So if you ever want to get stuff off your chest, then you can contact Childline. They're there to listen.
So although that was a video made by Childline, actually I think its way of describing anxiety is relevant to all of us and really helpful. And we've shared that video also with the youth champions from Bolder Healthier programme. So before we get into what we want you to do with other people, I did want to touch on a bit of looking after yourself, because we all have mental health, and it's important we think about how we look after our own mental health. This is particularly important because part of what you're doing as champions is talking to people, and that means you're hearing their stories. And we talk about that as emotional labor. You can't hear someone's story when you're hearing about their pain or their distress or their frustration and it not affect your soul, it not affect you. And that's what we call emotional labor. So it's important that as people who are trying to do good in the world, we also look after our own mental health and acknowledge that. So just some tips and things that could be helpful in terms of supporting your own mental health and well-being. Definitely keeping a diary or a journal, even if all you do at the end of the day is write down one thing that you've been grateful for that day. We know from research that can make a massive impact to your mental health. If you're someone that struggles to get to sleep at night because you've got lots of thoughts going around in your head, and perhaps you've had a conversation as a champion that you're still kind of carrying with you, writing it down into a diary can really help get it out of your head onto paper. And again, that's a method we know works to make a difference. This is a general tip for everyone. If you know you've got a stressful time coming up, think about how you kind of plan a recovery period afterwards. You're going to book some annual leave. You're going to plan a bit of something fun with friends or family. If you know that there are stressful times coming, do what you can to build some respite or some recovery time afterwards. Sleep is really important, and I certainly know from my own mental health that one of the things that I come into trouble with my mental health is if I don't get enough regular sleep. So keeping your sleep pattern and supporting it and protecting it is a really important thing to do. If you are having problems and you are struggling, please reach out for help. And although we're talking to you about how you help other people, all of the links, all of the information we share, absolutely you can use yourself if you're getting into challenged. And don't forget your physical health. There's a really good evidence base around particularly physical activity and mental health. We know that a 10-minute brisk walk every day, for example, is about as effective as the first-line medication treatment for mild to moderate depression. So instead of popping a pill, take a brisk walk every day. And we know that that does make a difference for people, particularly with, as I say, moderate depression. If you are in crisis, if things are really, really going pear-shaped and you're really struggling, please reach out for help. The helplines for Birmingham and Solihull Mental Health NHS Foundation Trust. There's also support through Birmingham Mind. There are national helplines as well, like the Samaritans, and you can also ring 999. Please do not suffer in silence. There is a lot of help available if people reach out for it. So let's move on to talk about what's the ask of you as community champions. So you'll be familiar with the format, I hope. We want you to talk about mental health issues and talk about the impact on the people that you care about, the people in your social networks, your community. We want you to connect people when they need help, and we want you to feed back and tell us what's missing, where the gaps are, and how we can support you better in this work. So let's talk about the talking. And it's important to remember that, as Bolder Healthier champions, we're not training you to be mental health nurses. We don't want you to be specialists. There are plenty of professionals whose job it is to help. What we want you to do is be able to have a conversation, to connect people to appropriate evidence-based information from reliable sources, and not hold those cases, but pass them on to professionals. And that's really important thing, particularly in mental health, because some areas we have seen people kind of going above and beyond, but actually then getting into a real mess because they're not mental health professionals and they're trying to do the right thing, but they haven't kind of let go and passed it to someone who's properly qualified. So in this space, really keep that in mind. We're asking you as champions to step into the space and open the conversation, but we want you to be able to pass that to a professional or to a support service, not try and manage it yourself. And there are lots of ways that this might appear in your life, lots of situations where you might see, particularly at the moment, the impact of the cost of living crisis on people, causing high levels of stress and anxiety, and that anxiety then becoming something that is going on every day over weeks, really regularly. You may have people that who've suffered a bereavement or whose relationship has broken down and going through a divorce or a separation. And there are times where people will be particularly vulnerable to developing mental health conditions, particularly depression and anxiety. So we suggest you use the similar format we have before, the ask, assist and act model, the 3 A's as a kind of structure. And one of the most powerful questions in terms of asking about mental health is that simple: how are you? Some of us can be very British about it and we ask it all the time, but we don't really listen to the answer. So the ask of you as champions is to use that how are you question, but really listen to the answer, be active in your listening, and listen to what people are saying and probe a little bit further. If someone says, oh, I'm tired, and you unpack that a little, go, are you having problems sleeping? I know some things that might be able to help. Use that opportunity to offer assistance and then to act on it to help connect them to support. And there are quite a lot of resources in the pack and the slide deck for you that helps you connect people to support. An example of this, and one of the most common things that we see is people with mental health issues will talk about feeling tired, that fatigue, but it's also a way of kind of dodging the question. The other one that I've certainly used in the past when I've not been in a great space is to say I'm fine, and just kind of avoid the question of how are you. So do probe a little bit further. Did you have a big night last night? And if someone says no, I'm just really tired at the moment, do you want to have a chat about it? I know there's some help, there's some resources that can help, there's some things you can do. And using that ask, assist and act framework can be really helpful. We use this kind of example, this hypothetical example of Suki, one of our Bolder Healthier champions, who lives in a cul-de-sac. She knows her neighbours, and she knows that one of her neighbours recently lost his wife. And this kind of conversation that says, I'm sorry to hear about you losing your wife, but I'm around if you want to have a chat at some point. Do pop in, offering that assistance, and building on that. At some point, the neighbour does pop round and discloses that they're feeling lonely. And of course, that's perfectly normal. If you've been married to someone, you've had a relationship and you've lost that person, it's perfectly normal to feel lonely and to be isolated. And what Suki does is said, there are places that can support, and would you like some help connecting to them? So that ask, assist and act space playing out in this just kind of short example. One of the things that is really important about mental health is talking about it, and that's what the young people embarking in Dagenham were doing. And this short video just shows some people talking about depression. We're not going to watch all of it, but just going to watch the first minute or so, because I think it really brings out actually that power of communication, the power of having the conversation, and that people's experiences are different, and that actually just talking about mental health can be really, really powerful and useful.
Depression is sometimes misleading, because a lot of the time I don't feel sad. I can have a laugh, I can go out to the park, I can get on with things, but there's just something missing.
Everything in my life was as good as it could reasonably expect it to be. I had a really nice girlfriend, I had a job that I really enjoyed. 6 months into it, I couldn't do it anymore. And it was actually my boss who recognised it in me one day, pulled me into his office and just said, take 2 weeks off. And I came back after 2 weeks and he was like, right, next project, let's get on with it. And I just could not do it. And that's really the first point when I was like, there's something wrong here.
I think I was 15. I became quite withdrawn from people. I'd generally been quite sociable. I was pulling out of activities. And I think for my parents, the thing they always said is it's something in the eyes. For about 4 years, I was just dead behind the eyes.
Nothing's a quick fix. It's going to be a long time, but the recovery will come. And quick fixes don't work.
It's kind of like when you want to lose weight, isn't it?
Yes.
If you go on a crash diet, you can easily lose whatever, but it will go back on. If you do it sensibly, over a long period of time,
but
you'll
said,
maintain
I thought before I started reading about it, medication was to...
So I'm going to stop the video there just because I think it goes into now talking about medication and treatment. But if you want to watch the whole thing, feel free. It's a really great video from Mind with real people with real life experiences of depression talking about it, but it shows how having that conversation can help. Now, for some of you, you'll be really passionate about this and you want to develop your skills more. And there are training programs out there that are available. Some of them do require funding. Some of them are free. In Birmingham, particularly over the last year, because we were able to access some money from the Department of Health, we were able to train more people in community organisations to provide mental health first aid training, and we're able to sponsor some of those training programs to deliver courses for free as well. So there are quite a few different options. There's also some e-learning packages on Health Education England's platform as well, and the Mental Health Trust itself provides some courses and sessions as well. So if this is something that really buzzes you and really resonates with you as a champion, and you want to increase your skills and move to that slightly higher level, then do have a look at these courses, because it's a great opportunity. And certainly I know colleagues that have done mental health first aid training have found it really, really powerful and really useful in supporting them getting even better at having these conversations every day. So moving on to the next element, the connect. I'm not going to dwell too much on this because the slide pack gives you a lot of links and a lot of information, but I wanted to highlight particularly our local service provision in Birmingham. So the Birmingham Solihull Mental Health NHS Foundation Trust, they run that 24-hour helpline. They also have a whole load of groups, and if you look on their website, there's a lot of information about different services for different needs. Birmingham Mind is a brilliant local charity, and I'm really pleased how we've worked together over the last couple of years. They offer a whole load of support groups. They also have a helpline. They're brilliant also at supporting people who might have a family member or a friend who's affected by mental health. So they're a really holistic offer as well. There is, of course, the National Samaritans Service, and that's an important one just to keep remembering is there. Samaritans, a brilliant charity offering brilliant support for people 24 hours a day, every day, all year. And then the final one I wanted to flag locally is the Waiting Room. This is a local website and app. It has a lot of information about local support groups, and the great thing about the Waiting Room is that it's like hyper local. So if there's a support group in Hall Green, it will be on the Waiting Room, whereas on some of the other websites, because they're the whole of Birmingham or the whole of Birmingham and Solihull, sometimes those very small support organisations get missed off, and the Waiting Room's a brilliant space to find stuff that's really hyper local to you. They've also got a load of other great information about other forms of support, so it's really worth checking out as a champion. Again, we've included the crisis information for you to have it to hand as well. So yeah, that's probably a useful one just to print off and have in a drawer somewhere or pin up on the notice board at work, for example. And then through the rest of the slides, there's more information on different national charities, support for some of the specific things that might be impacting on someone's mental health, like loneliness or bereavement, some of the personal challenges, practical things like financial support as well, some information about sleep, physical activity, social media, etc. So range of different information for you in the slides. A lot of it has hyperlinks to help you get to the exact website we're recommending. And this is just another example of kind of putting this into practice, that someone talking about sleep, which is one of the most common conversations that allows you to kind of open up a wider mental health conversation. But in this case, the Bolder Healthier champion both acknowledges it, and that's a really important part of that kind of assist phrase, is you ask and then you listen to what someone says, you acknowledge it, and then you say, can I help? Can I connect you to some support? And Anton, the champion here, is really demonstrating that by saying, actually that sounds tough. There's a reason why you're having challenges, but there is help out there, and the NHS is a reliable place. Would you like the link, or can I help you get there? So that's a really good example of putting that ask, assist and act into practice. The final ask of you as champions is to feed back to us. It's really important to us that the Champions programme isn't just about us kind of brain dumping on you loads of information. It is also about you telling us what you need to support you and how to make a difference in your community. So do feed back to the team through the email and let us know, as you're putting these things into practice, as you're having these mental health conversations, are people raising things that we haven't given you the resources to answer? Are they trying the resources and they're finding that they aren't really speaking to their lived experience? Feedback to us, because it's a really important part of the Champion programme, that it's a two-way conversation. It's not just us giving you information, it's also you telling us what needs to change and be different. Finally, thank you very much for being a champion. Thank you for being part of the energy and the passion to make our city better for everyone. The champions are a really important part of creating a bolder, healthier Birmingham and supporting everyone to achieve their potential in life. And a really important part of this is supporting Birmingham to becoming a mentally healthy city, and supporting everyone in the city to understand their mental health, know how to get help and support, and for that support to be there when they need it. So thank you for your time today. I hope the webinar has been helpful. I hope it's inspired you to act and to talk about mental health a little bit more this winter. And I hope you will continue to work with us as we build the Bolder Healthier Champion programme. Thank you.